Thank you for giving me the opportunity to present you this lecture about multimodal imaging of disorders of consciousness. This is the result of a collaborative work between the company that I'm heading, Imagelis, and Liège University's Coma Science Group. I'm Laurent Hermoye, I'm the CEO of Imagelis, and Liège Coma Science Group is headed by Professor Stephen Laureys. So first, what's a disorder of consciousness? It begins usually by a very sad and abrupt story, like a car accident or cardiac arrest, where a young girl, such as this one, in a few hours falls into a coma that can let her in a bed for whole life. The coma is a temporary state. It lasts for a few weeks, usually, and then goes into several possible stages, from the best, the recovery, to the worst, the death. But in this case, which is Perri C, which has been widely covered by the media, it's a vegetative state or a minimally conscious state. I don't have time to explain the distinction between all these states, but between coma and vegetative state, the eye open. And between vegetative state and minimally conscious state, you have some basic level of consciousness. And in locked-in syndrome, the patient is paralyzed, but is conscious. So there are behavioral assessment scales, such as the Glasgow Coma Scale or CRSR, where we assess the visual function, the motor function, etc. But still, because of the absence of communication and of motion, some patients are misclassified, and especially between the vegetative state and the minimally conscious state. So there are several advanced neuroimaging modality, and I will focus on the advanced one. Functional MRI, you probably saw two groundbreaking articles that the Coma Science Group has published in 2006 and 2007 in Science and the New England Journal of Medicine, where they showed some evidence of awareness in patients which were thought to be vegetative. We had a huge media coverage, Stephen Laureys becoming not only one of the most well-known clinicians and researchers in the field, but also some kind of TV star. So the idea was to let these patients play tennis in their heads or move in their house where they were fMRI scanned, and we showed that there are similar activation in some patients in the supplementary motor area that we see here, or the para-hippocampal gyrus here in normal volunteer than in patients, which were thought to be in the vegetative state. If they display activation, it means they are at least minimally conscious. Of course, it's not always as easy. One of the problems is that these patients are moving, and they don't move for 4 minutes, but at the 5th minute they have a spasm and moves a lot, like you can see here. And sometimes so much that it requires anesthesia. And sometimes the interpretation is complex and the activation are not as nice as the one that we can see in science. Look at this patient, which is in our post-processing software, Brain Magics. We see some activation, but are they real activation or just noise? It's sometimes tricky to interpret. Another technique is resting state fMRI, where the patient doesn't need to be stimulated. We can check several networks, and there are networks which are linked to awareness itself, a more medial one linked to internal awareness, and a more lateral one linked to external awareness. And we can show with resting state fMRI some anti-correlation between this network. We have also shown that the connectivity of the default network was inversely correlated with the level of consciousness. And when we get patients and scan them, we try to scan several networks with resting state fMRI and compare them with healthy patients. DTI, and we see here a color map in our software Brain Magic, where you can see that the white matter architecture is severely modified in this patient, some kind of hydrocephalus, some kind of neurodegeneration. We can try also to quantify the whole brain abnormality in fractional anisotropy and show this whole brain fiber tracking and compare it to healthy volunteers. The last technique is PET scan, nuclear medicine one, and here you can see several states: normal patient, sleep, anesthesia, and you see that in the vegetative states, it is abnormal, a bit like in anesthesia or close to brain deaths, and especially in some zones such as the precuneus. So to conclude, several questions. Well, first, what's the interest? There is no cure for this kind of disorder of consciousness. But for the family, for the friends, for the medical staff, it's very important to know if the patient is conscious or not, and to give at least a basic prognostic. Treatment, well, there are some experimental treatment. At least try to treat pain, try to make some basic rehabilitation. And there are some experimental treatment like zolpidem injection, deep brain stimulation, etc., but it's still experimental. And finally, try to establish a communication like in the New England Journal of Medicine paper. Try to check if the patient is happy, and also that trigger difficult question, especially in some country, the right to die for these patients who are in a very difficult condition. Thank you for your attention.